Welcome to our channel, the Fit Hub. We are telling about T. Respiratory Syncytial Virus, RSV. Respiratory Syncytial Virus, RSV, is a common virus that affects the respiratory tract and spreads very easily. People of all ages get sick from it, but babies, young children, the old, and people whose immune systems aren't strong should be especially worried about it. RSV is the main cause of bronchiolitis and pneumonia in children younger than 1 year old around the world, and it can make breathing very hard for people who are already weak. Transmission and signs and symptoms. RSV mostly spreads through breathing droplets, like those that come out of a cough or sneeze. You can also get it by touching dirty surfaces or objects and then touching your face, especially your eyes, nose, or mouth. The virus is most common in the fall, winter, and early spring, but this can change based on where you live. The signs of an RSV illness depend on the person's age and health in general. RSV usually shows up as weak, cold-like symptoms in older kids and adults, like runny nose, sore throat, mild cough, fever, congestion. In infants and young children, RSV can cause more severe respiratory issues, including wheezing, trouble breathing, and reduced oxygen levels. Signs of severe RSV in babies include rapid breathing, nasal flaring, bluish skin or lips, cyanosis, difficulty feeding due to lack of breath. Risk factors and complications. Certain groups are at higher risk for serious RSV infection, including premature babies, children under 2 years with chronic lung or heart conditions, older adults, particularly those with chronic illnesses like COPD or heart problems, immunocompromised individuals. Complications of serious RSV infection include pneumonia, bronchiolitis, and hospitalization. In rare cases, RSV can lead to long-term respiratory problems, such as recurrent wheezing or asthma later in life. Diagnosis and treatment. RSV is usually diagnosed based on clinical symptoms and history, especially during peak seasons. Laboratory tests, such as polymerase chain reaction, PCR tests, or antigen detection, may be used to establish the diagnosis in severe cases or during outbreaks. Treatment for RSV is mainly supportive, as there is no special antiviral cure for the virus. Management includes ensuring proper hydration, using over-the-counter pain relievers for fever and soreness, providing supplemental oxygen for serious cases, administering bronchodilators or corticosteroids in some people. For high-risk infants, preventive measures such as palivizumab, a monoclonal antibody injection, can lower the risk of severe RSV. Prevention. Preventing RSV involves good hygiene practices, including frequent hand washing, avoiding close touch with sick individuals, disinfecting surfaces regularly, keeping high-risk individuals away from crowded places during RSV season. In 2023, the FDA approved an RSV vaccine for people over 60, providing another layer of protection for vulnerable populations. Ongoing research aims to create vaccines and treatments to combat RSV across all age groups. RSV remains a major public health concern, but with proper prevention and care, its impact can be minimized, especially for at-risk groups.